Hi, I'm Dr. Xiao Chu Tai, Consultant General Surgeon. In conjunction with the MPGS week of PCSH, I would like to speak to you about the importance of surgical safety. Surgical care has been an essential component of healthcare worldwide for over a century. Every year, many millions of people undergo surgical treatment, and surgical interventions account for an estimated 13% of the world's total disability-adjusted life years. While surgical procedures are intended to save lives, unsafe surgical care can cause substantial harm. Safe Surgery Save Lives program is set about to improve the safety of surgical care around the world by defining a core set of safety standards that could be applied in all WHO member states. They reached consensus on 4 areas in which dramatic improvements could be made in the safety of surgical care, namely surgical site infection prevention, safe anesthesia, safe surgical teams, and measurements of surgical services. As you all know, much of this work has been initiated by global implementation of the WHO Surgical Safety Checklist, a 19-item tool created by WHO in association with the Harvard School of Public Health. A surgical safety checklist is a patient safety communication tool that is used by the teams of operating rooms professionals, namely nurses, surgeons, anesthesiologists, and others, to discuss important details about each surgical case. It is a final checklist prior to surgery used to make sure everyone knows the important medical information they need to know about the patient. All equipment is available and in working order, and everyone is ready to proceed. Some examples of items contained in the checklist. Firstly, the briefing phase. Verify with patient's name and procedure to be done. Allergic check. Medications check. Operation site and procedure. Lab test, X-ray. Secondly, the time-out phase, which is carried out in the operation theatre. Patient's position, operation site and procedure, antibiotics check. Lastly, the debriefing phase to be done after the procedure. Surgeons review important items, anesthesiologists review important items, and lastly, nurse reviews correct counts. Now I would like to talk to you about wrong surgery. What is wrong surgery? It is defined as wrong site or site surgery. Surgery performed on the wrong patients, the wrong body part, or the wrong site of the body. Secondly, surgery done on the wrong patients. Thirdly, wrong procedure. And lastly, wrong implant. It is a grave but distressing event and garners much attention when it happens. The problem is that it is so rare that doctors don't focus on it. Many surgeons don't think it can happen to them, so they don't take extra precautions. Wrong site surgeries are considered sentinel events, the worst kind of medical errors. One might think that wrong site surgeries usually involve younger or less experienced surgeons, but that is not the case according to the study. 2/3 of the surgeons who perform wrong site surgeries are in their 40s and 50s, compared with fewer than 35% younger than 40. These errors are more common in certain specialties, namely orthopedic, particularly involving spine surgery. Lastly, surgeon, hospitals, and surgery center ought to take wrong site errors more seriously. Absolute zero preventable